Why are so many people suddenly looking for minimally invasive bunion surgery instead of traditional open surgery? The answer usually comes down to one thing. People want less disruption to their lives. A lot of patients are looking for treatment options that allow them to recover faster, stay mobile, and avoid some of the difficult recoveries they've seen friends or family members go through. And that's one of the reasons minimally invasive bunion surgery has become increasingly popular. I'm Dr. Lance Reeves, triple board certified foot and ankle surgeon, and today I want to explain why more patients are choosing minimally invasive surgery, what makes it different than traditional open surgery, why recovery can look very different, and why many patients feel more comfortable pursuing surgery once they've learned these options exist. For me, one of the biggest reasons patients are leaning toward minimally invasive surgery is actually very simple. It's less surgical trauma. And this is where many patients immediately become more interested. Traditional open bunion surgery involves larger incisions, more soft tissue disruption, and a larger overall surgical footprint. With minimally invasive surgery, the incisions are dramatically smaller, in many cases only 2 to 3 millimeters. And when you create less disruption to the tissues, patients often experience less pain, less swelling, less scar tissue, and a smoother post-operative recovery. This makes a huge difference in how patients experience surgery. Another thing patients care about, and sometimes people don't always talk about openly, is appearance afterward. With smaller incisions, patients are often left with a much smaller scar compared to traditional open procedures. And for a lot of patients, especially those who have avoided surgery for years, that matters because they want their feet to not only feel better, but look better too. This is something many patients are pleasantly surprised by after surgery. One of the biggest advantages many patients notice during recovery is less pain and less swelling. Swelling may not sound like a huge deal initially, but swelling is one of the biggest things that slows people down after surgery. Swelling affects your shoe fit, it affects your mobility, comfort, walking, and return to activity. So when patients experience less swelling, they often transition back into normal shoes and daily life faster, which surprises most patients. Routinely, I'll have patients golfing, sailing, playing pickleball, exercising, or returning to the gym around the 5 to 6 week mark after bunion surgery. Another reason patients are choosing minimally invasive surgery is because many are able to walk immediately after surgery in a protective surgical shoe. Now, that doesn't mean surgery is effortless. Surgery is still surgery, but avoiding long periods of non-weight bearing can make a massive difference physically and emotionally for patients, especially for active adults, parents, business owners, retirees, moms, or anyone trying to maintain their independence during recovery. Truthfully, this is one of the biggest things that changes people's perspective on bunion surgery. Another thing patients increasingly appreciate is the ability to perform these procedures under local anesthesia. That means no general anesthesia, no intubation, no IV in your arm, and no being fully put to sleep. For many patients, that's a huge relief. One of the biggest fears people have isn't always the surgery itself, it's general anesthesia. A lot of my patients specifically tell me, I really don't want to be put to sleep, or I've had problems with general anesthesia in the past. Is there any way we can avoid it? Minimally invasive surgery allows patients to stay awake during the procedure and still remaining comfortable and pain-free. For many patients, avoiding general anesthesia dramatically lowers the fear surrounding the surgery. One of the other unique aspects of the minimally invasive approach I perform is that it does not require permanent hardware. So there are no plates, no screws, and no permanent implants remaining in the foot. For a lot of people, that's very appealing because with hardware, there's always the potential risk for irritation, prominence under the skin, loosening, failure, or needing another surgery to remove it. Now, every surgery has risks, but I always encourage patients to think about an important question. What does the worst case scenario look like? With a large open fusion procedure using plates and screws, the worst case scenario become very large revision surgeries with prolonged recoveries. With a minimally invasive surgery with no permanent hardware, there's less scar tissue, less surgical disruption, and no retained hardware. And for many patients, that creates peace of mind. At the end of the day, the philosophy behind minimally invasive surgery is actually very simple. Achieve meaningful correction with the least amount of surgical footprint possible. That means minimizing tissue disruption, minimizing downtime, minimizing pain, and helping patients get back to their lives faster. Because ultimately, patients don't want just an X-ray corrected. They want their life back. A lot of people spend years avoiding bunion surgery because they assume recovery has to be miserable. And while surgery is never something to take lightly, many patients are genuinely surprised when they learn how different modern, minimally invasive approaches can be. My goal is to always educate patients about their options so they can make informed decisions about their health and quality of life. If you found this video helpful, make sure to subscribe, follow along on social media, or check out the website below for more information. If you'd like to drop a question in the comments below, I'd be happy to make a video answering your comment specifically.